left, right, left, left, right.
It's a part of the body that's seldom given much thought. Whether we run, climb, or kick, our feet. But there's one group that has to keep a closer eye on their extremities than most: diabetics.
About half of diabetics have a problem called neuropathy, where the nerves in their whole body don't work very well. And they can go buzz, tingle, numb, pain, and then lose feeling.
Tim Metcalf has lived with those symptoms for 7 years when the Wasilla resident was first diagnosed with diabetes at a weight of 412 pounds. He shed much of the weight, but couldn't shake the threat of what happens to a percentage of all diabetics, eventually losing his feet altogether.
I can't feel the steel-toe shoes rubbing my feet, so when I get a sore or something, I take my boot off and my foot's covered with blood. That's how I know something's wrong. You know, I mean, it's that bad.
It's the numbers of amputations that caught the attention of Dr. Lee Dellon more than 20 years ago. As a plastic surgeon, he knew how to relieve pinched nerves and bring feeling back to patients with carpal tunnel syndrome. And if it worked on the wrist, why not the lower leg? It was a completely original idea that ran across the grain of traditional medicine. Cutting into the feet of diabetics was off limits. Too many risks, not enough study. But it worked. And of the 500-plus patients he's operated on so far, not one has lost their feet. The operation now to convince other surgeons.
I think it's more of a hopefulness that their minds are open. They're hoping that they can find something to offer these patients, but at the same time they are skeptical because it is contrary to what they've been taught.
Peripheral nerve.
Matt Heilala met up with Dellon at a medical conference a year ago and invited him to bring his techniques to Alaska.
I approach any new technology or new technique with caution, and it was just a nice situation to have the innovator and the inventor of the procedure that could come up and assist me in the first one. Then I can watch my own patient long term.
Can we...
Last week, ABC Alaska News was there to watch the first such surgery in the entire state. A matter of locating Tim Metcalf's swollen, coated, and pinched nerve.
In diabetics, the nerves get heavily infiltrated by fat.
And relieving pressure.
Little additional left lateral, if you could.
The effects, as we found out, were instant. What was flattened and dying moments before suddenly was pumping with blood. The whole procedure, less than an hour. For Metcalf, a lifetime of difference.
But he came in and stuck his hand down in this big bandage they had on my foot, and he said, "Do you feel this?" And I just looked at him and said, "You're going like this."
Only days later, and the 48-year-old is walking around, telling his friends that there is new hope for diabetics. Perhaps the best endorsement, though, Metcalf is heading back to get his left foot done this November. In Anchorage, Ty Hart for ABC Alaska News.